Hello. Morning.
Thank you. Good morning, colleagues, and can I extend a warm welcome to the Secretary of State, West Streeting, and our Prime Minister, Sir Keir Starmer.
Thank you.
My name is Pauline Cranmer. I'm the very proud Chief Paramedic for the London Ambulance Service. And we here at the London Ambulance Service are really proud to be part of this conversation today. We are all passionate about healthcare, so the opportunity to be part of the discussion for the NHS for the next 10 years is fantastic. We are the only pan-London emergency and urgent care provider. So we have a very unique and privileged view into the healthcare needs of Londoners. In fact, yesterday, 11,500 people contacted us, either through 999 or through 111, needing support, treatment and advice in some cases for their healthcare needs. We are in the one of our education centres here, where we recruit, develop, educate and train our paramedics, the paramedics of the future, to work across the health system, in ambulances, in control rooms and in other healthcare settings. We have a unique opportunity here. We are one of the top 5 providers for apprenticeships, a unique position and the only NHS trust to be there. Using our opportunities with data, we are committed to health inequalities, making it fairer for access for patients to gain their health care. Our paramedics are leading the way in pioneering pathways, engaging with communities, understanding the gaps in their need and how we can support them in our role. We are also part of London, so the health of London is really important. And we have an ambition to train a generation of school children in being able to undertake CPR, the most critical of calls when it's needed. I'll stop at that point, and I'd like to introduce the Secretary of State, West Streeting.
Thank you very much, Pauline. And thanks to all of you for being here with us today to kick off what will be the biggest national conversation about the future of the NHS since it was founded 76 years ago. And there couldn't be a more important time for us to have this conversation. The NHS is going through what is objectively the worst crisis in its history. And whether it's people struggling to get access to their GP, dialing 999 and an ambulance not arriving in time, turning up to A&E departments, waiting far too long, sometimes on trolleys in corridors, or going through the ordeal of knowing that you're waiting for a diagnosis that could be the difference between life and death. Worse still, receiving a prognosis that amounts to a death sentence that could have been avoided because the NHS didn't reach you in time. That is, I'm afraid, a daily reality in the NHS today, which is why on day one, this government came in and said very starkly that our NHS is broken, because we feel very strongly that unless you're honest about the scale of the problem, you're not going to rise to the challenge to turn the situation around. And our NHS is broken, but it's also not beaten. One of the reasons we're with London Ambulance Service this morning is because this service is a great example of what the NHS could be with the right combination of both investment but also reform, change and modernisation. This is a service that is showing what the NHS could be if we deliver the 3 big shifts that we need. A shift of care out of hospital into the community. The NHS is a neighbourhood health service as much as a national health service, with care much closer to people's homes and sometimes in the home itself. This is a service that is embracing the revolution that's taking place in data, life sciences and medical technology to bring to life the shift from the analogue NHS that we have today, that's one that is not just benefiting from but driving the revolution in data, life sciences and medtech. And this is also a service that, although designed to be an emergency responder, is also thinking in a system-wide way about prevention. How do we prevent ill health in the first place? How do we prevent the need for someone to be in the back of an ambulance or arriving in an A&E department? And one of the things that gives me great hope about the future of our NHS is that every single day, in every part of the country, there are great people providing outstanding care against the most challenging backdrop. And if there was just one thing this government could do to turn the situation around, it's to take the best of the NHS to the rest of the NHS, because there are so many of you in the NHS and social care system right across the country showing us what the future could look like. And that's why we're embarking on this national conversation today. There are some people who are saying to us, look, you're the government, why aren't you just imposing your change? Why aren't you just coming in and telling the NHS how it's going to change? Well, it's true that we've come in and we've hit the ground running, doing things like solving the junior doctor strike, employing 1,000 more GPs onto the front line, introducing new public health measures. So we're not wasting time in getting started. But we also feel really strongly that the best ideas aren't going to come from politicians in Whitehall. They're going to come from staff working right across the country and, crucially, patients. Because our experiences as patients are also really important to understanding what the future of the NHS needs to be and what it could be with the right ideas. So this conversation is going to take place in every corner of the country, in every part of the NHS, with a wide range of patients. Because when we launch our 10-year plan for the future of our National Health Service, we want you to feel like this is your plan, that your fingerprints are on it, whether you are a patient that relies on the NHS or whether you're a member of staff that uses it. Because this moment is as important as the 1948 moment when that Labour government created the NHS, built the NHS for the 20th century. It's now up to this Labour government to rebuild our NHS for the 21st century. And with your help, that's exactly what we're going to do. You can start that today by visiting change.nhs.uk and start the conversation now, join the conversation now, shape the conversation now. And we're going to be running events right across the country and making sure that we will be able to look back on this moment and say quite genuinely that we were the generation that took the NHS from the worst crisis in its history, got us back on its feet and made sure it's fit for the future. So thank you very much for joining in and thank you for choosing change, because with this Prime Minister, we're going to meet the challenges facing our country and build a better, fairer, more equal society for everyone in Britain. So it's my pleasure to introduce the Prime Minister.
Thank you, Pauline. Thank you, Wes. And can I just start by saying a massive thank you to all of the NHS staff that we've got here today, because I know that you come to work every day to help people who are ill, to save lives, and you never know quite what's going to be thrown at you. But every single day you come to work not just because it's a good, interesting job, a vital job, but also with a mindset which is about public service, which is about using all of your skills and experience to help other people. And that's an incredible thing to do. And sometimes it's very important on events like this just to start with a really simple thank you to each and every one of you for what you do every single day. And for all of us, the NHS is personal, and some of you will have heard this before, but my mum was a nurse, a very, very proud nurse. My sister was a nurse. My wife works in the NHS at the moment in one of the big London hospitals. Her mum was an NHS doctor, and therefore this runs through me. And of course, again, as some of you will have heard, that my mum had Still's disease when she was 11 years old, and this was a very aggressive illness for her that turned out to mean that she went from having the NHS as her livelihood, if you like, to it being her absolute lifeline every single day, depending on the NHS. And that's what I grew up with, knowing the NHS through my mum, in and out of hospitals, in and out of high dependency units, and seeing for myself as a young teenage boy the work that the NHS did, in my particular case with my mum, but every time I tried to say thank you, they reminded me they did this for somebody else's mum, sister, brother, granddad, child, every single day. And so thank you for what you are doing. And I know that the last 14 years have been really, really hard. We've had austerity, we haven't had the right money and resources, we've had a reorganisation of the NHS that made no sense and made things worse, then had the burden of COVID, and everything that followed after that. And frankly, you deserve a lot better than that. And I know that when the waiting lists are so high, that has an effect on the morale of every single person working in the NHS who are doing their level best, but sort of really up against it. And I think that's the context in which this 10-year plan has to be seen, because this is a government that's not just come in to say thank you, as we rightly do, for what you're doing. It's not just a government that comes in and says we're going to get the NHS back on its feet, is exactly what you would expect. But we want to go further than that. We want to make sure that under this Labour government, the NHS isn't just working a little bit better than it is now. We all want that. Everybody is entitled to that. We want an NHS which is reimagined, made fit for the future, so that we can be as proud as we are. Every time there's the anniversary of the NHS being set up, all of us, myself included, are really proud of the 70, 75, however many extra years now. On top of that, the NHS has been going. We look back with great pride at that post-war Labour government that set up the NHS. What we want to achieve is a situation where we reimagine the NHS, make it fit for the future, and where in 10, 20, 30 years people look back at what we did and say that was the government, that government of 2024, that Labour government, that made sure the NHS is fit for the next 75 years. And we want you to be part of that, not just because you're working within the NHS, but of course because you will have the best ideas. And as Wes said, when he's been doing media on this, some people have pressed him as to why do you need to do a consultation. I'll tell you exactly why. I ran the Crown Prosecution Service for 5 years. I had 7,000 staff. We did every prosecution in every criminal court in England and Wales. We had 100 offices, and in the first year or two, I went to every single office. I got the staff together, and I asked them, what's the biggest challenge that you're facing in this office in the work that you're doing? And they knew, because they faced it every day, what the biggest challenge was. And then I asked them, what's your best idea for fixing the particular problem you've got? Because, as you know, if you go to work every day and you're confronted with a particular problem, you start to think, well, how are we going to fix this? And therefore, we want to hear from you and from as wide a number of people as possible, both in the NHS and people who are using the NHS, because this needs to be the once-in-a-generation opportunity for you to put your fingerprints on the future, literally to craft the service that you are working for. So this is a really important conversation to create that NHS of the future, a moment in our history. And, you know, there are some obvious things that I think that we do need to do. We need to go from analogue to digital. We need to use much better technology, whether that's in the ambulance service, in our hospitals, in our neighbourhoods, making much more use of technology. And there are so many examples of AI and scans and radiologists working together to achieve much greater results. Plenty of examples like that. I genuinely think that we need to make a neighbourhood health service much closer to people in their community. You will be familiar with cases where people don't access the health care that they need when they need it because it's not close enough to them. Or too many people go to the hospital A&E when they should and will be better dealt with closer to home. So we need to move to that model. And then the preventative piece. If we can get in early and prevent people becoming as ill as they sometimes become, what a game changer that would be. And I'll just give you one example. Some of my colleagues have heard it more than once, but it is absolutely etched in my mind. I went to Alderhay Hospital, which is a brilliant children's hospital, and we actually went to the ward where they were dealing with heart operations on 2-year-olds. This was really humbling, by the way, to see the brilliant NHS staff, to see, in my case, a young 2-year-old who just had massive heart surgery, really brave little boy and his family. Really inspiring and humbling. But in that same visit to the children's hospital, I learned that the biggest cause of admission to that hospital, Alderhay, and to all children's hospitals for 6 to 10-year-olds is children coming in to have their teeth taken out because they're decaying. something that could have been prevented. It's a small example, but I felt really angry on behalf of the NHS staff that they were being asked to do operations which didn't really need to be done if somebody had stepped in earlier. There are so many examples of preventative measures that we could take. Now, there's some of our ideas about how the NHS needs to go forward. It is broken but not beaten, and that's important. And I know it's hard when you work in the NHS to hear that it's broken. As I say, my wife and I have pretty well an evening conversation about the morale in the staff in her hospital. It's really, really tough. But people do prefer us to say, this is the state of it, we're going to fix it. We're not just going to make it better run, we're going to make it transform so that it's fit for the future. And imagine the pride that you will all have of putting your fingerprints on the NHS of the future. It's an amazing opportunity for all of us. So we want to take this forward. We want people to feed into this. We're absolutely determined to do this. We're a mission-driven government, and that means we're a government with a driving sense of purpose and a real sense of priorities. We have 5 missions, only 5, and one of them is making the NHS fit for the future. So this is one of the big themes of this government, and all of our decisions are taken according to whether they help or hinder the mission. So this is vital work for us as we go forward. Please get involved in the conversation. Feed in your ideas, help us build the NHS fit for the future, and think of the pride that future generations will have that this Labour government it took the NHS from the situation it's in at the moment, picked it up and made it fit for the future. Thank you so much.